Today we're going to discuss the integumentary system. The first couple of slides in this PowerPoint have the combining forms, the prefixes, and the suffixes related to the integumentary system. The integumentary system is the outer boundary of the body. It is the part that is in direct contact with the external environment. The skin is the body's outer protective covering. The root integument means covering. The integumentary system is the largest body system. It is important in maintaining homeostasis. And if you recall from prior lessons, homeostasis is the balanced internal environment of the body. There are several functions of the integumentary system. The skin is the body's first line of defense against harmful bacteria and other agents of disease. Sensory receptors located within the skin detect touch, pressure, heat, cold, and pain. The cells of the body are bathed in an internal sea, a carefully regulated dilute salt solution essential to life. As we move about in the air, which is relatively dry environment, the skin prevents loss of fluid so that the cells do not dry out. The skin also helps maintain body temperature. It excretes excess water and some waste from the body through sweat glands. And it contains a compound that is converted to vitamin D when the skin is exposed to ultraviolet rays from the sun. The three main layers of the skin are the epidermis, which is the outer layer of the skin, the dermis, which is the inner layer of the skin, and the hypodermis, which is the subcutaneous layer of skin. The epidermis consists of stratified squamous epithelial tissue. The outer cell of the epidermis continuously wears off and are immediately replaced by new cells. Over most of the body, the epidermis is only about as thick as a page of a book, yet it consists of several sublayers or strata. In the stratum basale, there are epidermal cells that constantly divide by mitosis, producing millions of cells every day. These cells mature as they are slowly pushed upward toward the outer surface by newer cells beneath. As the cells move toward the body surface, epidermal cells manufacture keratin, a tough, waterproofing protein that gives the skin mechanical strength and flexibility. The stratum corneum is the outer sublayer of the epidermis. It takes about 2 weeks for new epidermal cells to be pushed up from the stratum basale into the stratum corneum. The epidermis does not have blood vessels. The epidermis contains melanin, the pigment that gives color to the skin. The dermis is the thick layer of skin beneath the epidermis. It provides strength and elasticity. Collagen is largely responsible for the mechanical strength of skin. It also permits the skin to stretch and then return to its normal form. Blood vessels and nerves, which are generally absent in the epidermis, are found throughout the dermis. The upper portion of the dermis has many small, finger-like extensions called dermal papillae, which project into the epidermal tissue. Extensive layers of capillaries in the papillae deliver oxygen and nutrients to the cells of the epidermis and also function in temperature regulation. The patterns of ridges and grooves visible on the skin of the soles and the palms, including the fingernails, reflect the arrangement of dermal elevations beneath the dermis. The dermis produces vitamin D when exposed to the sun. The hypodermis is also known as the superficial fascia or subcutaneous tissue. It's a thick, fatty layer that helps protect underlying organs from mechanical shock. It also insulates the body, which conserves heat. It attaches skin to the underlying tissues. It consists of mainly loose connective tissue and adipose tissue. The blood vessels and nerves of the skin originate here. The nerves provide sense of touch. The accessory structures of the skin include the hair, nails, sebaceous glands, and sweat glands. Hair, which helps protect the body, is found on most skin surfaces. Exceptions include the palms of the hands, soles of the feet, and lips. The part of the hair that we see is the shaft. The portion below the skin surface is the root. The root, together with its epithelial and connective tissue coverings, is called the hair follicle. At the bottom of the follicle, there is a little mound of connective tissue containing capillaries. These blood vessels deliver nutrients to the cells of the follicle. Dead cells form the shaft of the hair. As long as the follicle remains intact, new hair will continue to grow. If the follicle is destroyed, as by laser treatments, new hair cannot grow. Hair helps keep the body warm. Nails develop from horny epidermal cells and consist mainly of a closely compressed tough substance, keratin. The nail body is the visible part of the nail. The nail bed is the layer of epithelium below the nail. Nail beds are rich in capillaries. These blood vessels give nails their pink color. Nails protect the ends of the fingers and the toes. Sebaceous glands are also known as oil glands. They are generally attached to hair follicles by little ducts through which they release their secretions. These glands are the most numerous on the face and scalp. Sebaceous glands secrete an oily substance called sebum that oils the hair, lubricates the surface of the skin, and helps prevent water loss. Each sweat gland is a tiny coiled tube in the dermis or subcutaneous tissue with a duct that extends up through the skin and opens onto the surface. Sweat glands excrete excess water, salts, and small amounts of nitrogen wastes. Sweat glands help to cool the body. Pigment cells scattered throughout the lowest layer of the epidermis produce melanin. Melanin gives color to skin and hair. In dark-skinned individuals, the pigment cells are more active and produce more melanin. The pinkish hue of light skin is caused by the color of blood in the vessels of the dermis. Skin color is inherited. Some ways to promote healthy skin include good nutrition, hydration, sleep, and exercise. The aging process affects the skin. Because of the aging process, the skin becomes less elastic. It loses strength. Brown spots may occur on the wrists and the hands. The skin may become dry and itchy. There are fewer blood vessels. The fatty tissue layer is lost. The hair may whiten or gray. The skin thins and sags. The skin is fragile and easily injured. Folds, lines, and wrinkles appear. Fewer nerve endings affect temperature, pain, and pressure sensation. There is decreased secretion of oil and sweat, and the skin is more sensitive to cold. Some CNA interventions for aging skin include the following. Patients should be protected from drafts and cold air. CNAs can check the thermostat setting. Higher temperatures are preferred. Mild soaps should be used. Lotions and creams should be applied to prevent drying. Foot care should be provided, and it's important to take measures to prevent burns. Here are some things that the CNA should report to the RN regarding the integumentary system. Skin that is pale, bluish, yellowish, or flushed, rashes, abrasions, or bruising, moles that have changed in appearance, redness over a pressure point that does not go away, area over a pressure point that becomes pale or white, drainage from a wound, blisters, swelling, pain, and weight changes. Alopecia occurs when the immune system attacks hair follicles and causes hair loss. Hirsutism is excessive growth of hair. Dandruff occurs when small pieces of dry skin flake off the scalp. Pediculosis is lice. Scabies is an infestation of the skin by the human itch mite. Shingles is a painful rash that typically develops on one side of the body. Shingles is also called herpes zoster. It is related to a chickenpox reactivation. It is a viral infection that follows the path of a nerve. A blistery rash appears as a single line on one side of the body. Shingles is very painful. It is contagious for someone who has never had chickenpox. It is important to keep the rash covered and wash hands often. Causes of burns include hot liquid, electrical equipment, hair dryers, heating pads, and chemicals. CNAs should never put oil, lotion, or butter on a burn. Instead, it's important to cool the area and cover loosely. A first-degree burn involves the epidermis. It will result in redness and pain. A second-degree burn involves the dermis. It will be red and painful with swelling and blistering. A third-degree burn involves the dermis and underlying tissues. There will be scarring. Muscle and bone may be involved. There will be swelling and peeling. With third-degree burns, the nerve endings are damaged, which results in the patient not feeling a lot of pain in the area of the burn itself. Instead, pain will be felt in adjacent areas. This slide shows a picture of the layers of skin affected by the first, second, and third-degree burns. A wound is a break in the skin or mucous membrane. Wounds commonly result from surgery, trauma, unrelieved pressure or friction, decreased blood flow through arteries or veins, and/or nerve damage. Open wounds involve a break in the skin or body tissue. Abrasions, puncture wounds, lacerations, and incisions are examples of open wounds. With an abrasion, an area is damaged by scraping or wearing away of the skin. A puncture wound is a wound made by a pointed object. A laceration is a deep cut or tear in the skin. An incision is a surgical cut made in the skin. Closed wounds occur when the skin remains intact. For instance, bruises and hematomas are examples of closed wounds. A bruise is a mark on the skin caused by blood trapped under the surface. A hematoma is a pool of mostly clotted blood that can occur anywhere in the body, including the brain. Symptoms of wound include pain, damage to the skin, discoloration of the skin, bleeding, fever, or chills. On this slide, the left picture is an abrasion, which is a partial thickness wound caused by the scraping away or rubbing of the skin. On the right is excoriation, which is loss of the epidermis, the top skin layer, caused by scratching, or when the skin rubs against skin, clothing, or other material. On the left of this slide is a laceration, which is an open wound with torn tissues and jagged edges. On the upper right is a penetrating wound, which is a wound that breaks the skin and enters a body area, organ, or cavity. On the left lower portion of this slide is a puncture wound, which is an open wound made by a sharp object, a knife, nail, metal, wood, or glass. This slide shows a picture of a surgical incision, which is a cut produced by a sharp instrument that creates an opening into an organ or body space. This slide here shows normal skin, and then it shows the different types of wounds that were discussed and what layers of skin they go through. The wound healing process has 3 phases. Phase 1 is approximately 3 days, and that is when bleeding stops and a scab forms. During this phase, signs and symptoms of inflammation will appear. They include redness, swelling, heat or warmth, pain, and loss of function. Phase 2 is days 3 to 21. During this phase, the cells multiply to repair the wound. Some wounds do not heal in a timely manner. A chronic wound does not heal easily and within about 3 months. Phase 3 is days 21 to 2 years. The scar gains strength. The red, raised scar becomes thin and pale. Wound healing occurs in 3 ways. First, or primary intention, is when the wound is closed. Second intention is when the wound heals from the bottom up. Third intention is when the wound is left open and closed later. This slide here shows first intention or primary intention wound healing. You have the incision, it is closed, and there's a fine scar left. This slide here shows wound healing by second intention. There's an irregular large wound with a blood clot. The tissue fills the wound. It's not closed like in the prior one, and the patient is left with a large scar. Finally, this is wound healing by third intention. There's a contaminated wound, so a wound that has bacteria in it that's prone to infection. Tissue begins to fill the wound, and it's later sutured closed once the infection is gone. Many factors affect healing and the risk for complications. They include wound type, age of the patient, health, nutrition, and lifestyle. Age, smoking, circulatory disease, and diabetes affect circulation. Good nutrition is needed. Protein is needed for tissue growth and repair. Some complications of wound healing include hemorrhage, infection, dehiscence, and evisceration. Hemorrhage is the excessive loss of blood in a short time. Shock results when tissues and organs do not get enough blood. An internal hemorrhage occurs when there is bleeding inside tissues and body cavities. A hematoma is swelling that contains blood. The area is swollen and reddish blue in color. Shock, vomiting blood, coughing up blood, and loss of consciousness signal internal hemorrhage. An external hemorrhage occurs when there is bleeding outside the body. Common signs are bloody drainage and dressings soaked with blood. An infection is contamination that can occur during or after injury or surgery. An affected wound appears inflamed and has drainage. The wound is painful and tender. The person may have a fever. Dehiscence is the separation of wound layers. It may involve the skin layer or underlying tissues. Abdominal wounds are commonly affected. Evisceration is the separation of the wound along with the protrusion of abdominal organs. Coughing, vomiting, and abdominal distension places stress on the wound. Dehiscence and evisceration are medical emergencies. The RN will cover the wound with large sterile dressings saturated with saline. This picture here shows evisceration. The intestine is protruding from separated wound. There are a couple ways that we look at wound drainage. Serous drainage is clear, watery fluid. Sanguineous drainage is bloody drainage. Serosanguineous drainage is thin, watery drainage that is blood-tinged. and purulent drainage is thick green, brown, or yellow drainage. This slide here shows some examples of the wound drainage. So picture A shows serous drainage. Picture B shows sanguineous drainage. Picture C shows serosanguineous drainage. And picture D shows purulent drainage.